Senator Cramer, please.
Thank you, Mr. Chairman. Thank you all for being here, for your willingness to serve, and congratulations to all of you. I have a couple of questions, Dr. Martinez, that I want to focus in on with you, and a little bit of feedback there. I'm going to start with, you're obviously familiar with fertility awareness, so fertility awareness-based method, a natural type of pregnancy prevention that's used by several women. Obviously, it enables them to observe and chart changes in one or more biomarkers. It's a method, of course, that has no side effects. It's relatively inexpensive. Currently, though, there's a lack of access to this at military installations or treatment facilities, and of course, TRICARE doesn't cover it. Would you commit to looking into adding fertility awareness-based methods to the options that our service members have when they're doing their family planning?
Senator, thank you very much for the question. You know, the health care of all service members, including female service members, is of utmost importance to a department. If I get confirmed, I commit to you, we need to look at ways to bring parity for the reproductive health issues relating to our service members. So yes, I'll be looking into those kind of issues, and we need to come about with a parity equation with the rest of the nation and how we address all those issues.
I appreciate that. We'll look forward to that upon your confirmation and to following up. Also, you know, DARPA's pandemic preparedness program, Doctor, was really integral in lots of ways. I mean, it was very successful, but it was particularly integral for antibody discovery programs, and that, of course, led to a therapeutic to combat COVID. And now I think we see, as we look back on that and as we look forward, that these therapies are probably the best defense and maybe even the best offense in combating COVID and perhaps other viruses in the future. So there's a company in North Dakota, Genovac, that's been leading and working with DARPA in antibody discovery. And through them, I've seen just how very fast we're able to respond and how quickly we can develop these targeted responses to other viral threats. So do you agree that we should be devoting as much, if not more, resources for therapeutic discovery and development? And maybe if you just want to elaborate a little bit on what else DOD can do to prepare for future pandemics along these lines.
Senator, my last posting was a commander for Dietrich, and I'm very proud to have been part of that exercise of bringing about new technology that now we see all over serving the country well. I was partnered with DITRA, I was partnered with DARPA, trying to advance all this kind of technology. And by the way, mRNAs, you know, vaccines, that's where they came about from.
Yes.
The genesis of all that new technology was a DoD-based research, program. So if confirmed, sir, I would love to keep being a proud member of that team that advances the science for the country and comes out with new solution sets to the new problems that we're going to be facing.
That's great, Doctor. I might then use this opportunity, as I often like to invite you to North Dakota, to Fargo, to see some of what's going on right there. And you can either come in February, that earns you a lot of street cred, or you can come in June, which is just nice to, time to visit. With that, I yield back. Thank you, Mr. Chairman.